Hello doctors. Today let's talk about Cushing syndrome and let's also talk about the causes of Cushing syndrome and how to solve a question asked on this topic. When you say Cushing syndrome, the normal symptoms would usually be like the patient is obese, the buffalo hump, a moon facies and this striae. All these would point out to Cushing syndrome. But let's see the cause. First, see what happens in the normal physiology. We have the anterior pituitary and the posterior pituitary. We have kidneys, on top of it the adrenals, and then we have ACTH produced by the anterior pituitary. This ACTH from the anterior pituitary acts on the adrenals and causes the adrenals to release cortisol, that is basically the steroid. This is what happens normally. Now let's see how Cushing syndrome develops with different causes. The first cause would be exogenous steroids, and this is the most common cause. When the doctor prescribes you steroids, you are taking something similar to cortisol with different names like dexamethasone or hydrocortisone, but all those are steroids. When you take excess of steroids, what happens is that in your body there would be lots and lots of steroids. This lots and lots of steroids goes to the anterior pituitary and says that we already have enough steroids, so stop producing ACTH. So the production of ACTH decreases, and so the action of ACTH would decrease and the steroid production would decrease. But when there is more than enough amount, that would cause Cushing syndrome. If you see, this cortisol made this ACTH low. So when using exogenous steroids, the ACTH level would be low because there is a negative feedback. Now then suppose if you have an adrenal tumor, that is an adrenal adenoma that can produce cortisol. What happens is that this adrenal tumor now starts producing steroids, that is the cortisol. So there is more and more of cortisol causing Cushing syndrome. Now this excess cortisol goes to anterior pituitary, gives a negative feedback so that ACTH level decreases. So remember that whenever the problem is in adrenal, the ACTH would be low. Now the next cause is a pituitary tumor. Now imagine a pituitary tumor secreting ACTH. So when there are lots and lots of ACTH, this would go and bind to the adrenals and cause the adrenals to produce more and more of steroids. Now these steroids may try to give a negative feedback, but this pituitary is not functioning well, so the signals are not given properly. The anterior pituitary still continues to produce more ACTH and more cortisol would be released. So in the case of pituitary tumor, the ACTH level is high. Now the next cause is ectopic ACTH. Imagine if you have a lung with a tumor, probably a small cell lung tumor. This tumor can produce ACTH. So there is ACTH coming elsewhere from the pituitary. This ACTH can also bind to the adrenals, causing release of more steroids. This more and more steroids would go and give a negative feedback to the anterior pituitary. So the ACTH would get reduced. But even though if this ACTH reduced, there is ACTH coming from somewhere else which does not respond to a negative feedback. So the ACTH level at last would still be high. Remember, I told you two causes with ACTH low and two causes with ACTH high. Now let's see how to solve the questions with an algorithm. Now when a patient comes with Cushing syndrome symptoms, first you have to confirm the diagnosis. Then you have to locate the cause. First, to confirm the diagnosis, you do a low-dose dexamethasone suppression test. Dexamethasone is something just similar like cortisol. You give a tablet of dexamethasone. What should happen is that usually what happens in the morning, the level of cortisol is high. That is due to diurnal variation that normally happens in every one of us. In the morning, the cortisol level should be high, but when you give a low dose dexamethasone, that is a steroid, this steroid goes to the ACTH and goes to the pituitary and decreases the production of ACTH. So if decreased ACTH, then there will be decreased production of cortisol. So when you check the levels of cortisol in the morning, it would be decreased. But whenever the patient is having a Cushing syndrome, even though if you are giving this low dose dexamethasone, that dexamethasone would go to the pituitary and decrease the ACTH. But the level of cortisol would be still high, because in Cushing syndrome the cortisol could be coming from anywhere else. So with the low dose dexamethasone suppression test, you would confirm the diagnosis of Cushing syndrome. Now you have to find the cause. To find the cause, we do check the level of ACTH. If the ACTH is low or high, we have different causes. If the ACTH is low, the probable cause would be exogenous steroids or adrenal tumors. If the ACTH is high, we do a high dose dexamethasone suppression test. This high dose steroid is just enough to suppress the pituitary adenoma that is secreting ACTH. Remember, before I said there is a pituitary adenoma secreting ACTH which would not respond to the negative feedback. But when you give high doses of steroids, those high doses would go to the pituitary and suppress the ACTH production. So by this way we can differentiate the cause. If the ACTH decreases, that would be a pituitary tumor. If the ACTH is still high, then the problem is coming from the ectopic, that is from the lung cancer or anywhere else like pancreatic cancer. So with this algorithm, you can diagnose Cushing syndrome and find the cause as well. That's all for today. Thank you, doctors.